Welcome back to AAKP's National Kidney Patient Consumer Policy Roundtable, the critical need to overcome government determinants of health. For those just joining us, I'm Ed Hickey, AAKP President, Chair of AAKP's Veterans Health Initiative, and a fellow kidney patient. Our next discussion topic, opportunities and challenges for stakeholders, federal policy implementation and interpretations impacting kidney patients and medical innovation, will include two fast-moving expert panels. There's our first fast movers right here. Joining us for part one of our discussion regarding transformations in the national transplant system is our new friend, Alicia Hennie, Vice President of External Affairs for the United Network for Organ Sharing, UNOS, and a seasoned policy professional, and our good friend and longtime ally, Peggy Tighe, Principal for Pyles, Sutter, and Verville, PC. Peggy provides strategic government relations and legislative counsel to the American Society of Transplant Surgeons. And finally, Paul Conway, AAKP's Chair of Global Policy and Global Affairs and a 26-year transplant recipient. Alicia, I have a few fast questions for you, but would like you to first give a brief introduction to UNOS.
Thanks. Thank you so much, Mr. Hickey. I'm so pleased to be here. Good morning, everybody. Thank you for having me. I'll start by sharing a little bit about UNOS, how we got started. Our work, no matter what's going on, is always centered on how to help patients get the transplants they need and honoring the donors that make those transplants possible. We are a nonprofit headquartered in Richmond, Virginia, so not too far from here. Our mission is to unite and strengthen the donation and transplant community to save lives. UNOS has managed the nation's donation and transplant system, known as the Organ Procurement and Transplantation Network, or the OPTN, under contract with the federal government since the 80s. As the OPTN contractor, UNOS has helped shape the organ donation and transplant system with more than 1 million transplants having been performed and an increase in transplants each year for over a decade. Over the years, UNOS has grown into more than just the OPTN contractor, spearheading new technologies and innovations that will help the donation and transplant system work more efficiently.
Wow, thank you. Given the many changes that are happening across the kidney ecosystem, can you tell us how UNOS is working to address these changes, including issues related to EGFR and kidney offers to potential recipients?
Oh, great question. Thank you so much for asking me about EGFR. So through our work as the OPTN contractor last year, we helped the transplant community implement a new policy to prohibit the use of race in EGFR calculations and to ensure that any kidney patient who had been disadvantaged by a race-inclusive EGFR calculation would have their waiting time modified. All active kidney transplant programs attested to the policy's requirement by the deadline in early January, and more than 14,000 waiting time modifications have been completed, and to date, more than 2,250 patients have received a transplant following their waiting time modification. This was an important OPTN policy update, and it has helped and is continuing to help increase equity in the transplant system, something that's extremely important to UNOS. But as you mentioned with the offers, too many people are waiting for a life-saving organ. Our work is far from done. One of the things we're working on is how we can help patients get the organs they need faster. One example is the offer filter that UNOS developed, which enables transplant programs to filter offers they would not usually accept, helping match organs with a candidate more quickly. So since being implemented with kidneys in 2022, on average, a program that uses the tool bypasses 48.7% of their offers, saving those transplant teams from reviewing offers they never intended to accept, and in turn, getting those offers to programs willing to accept them for patients. These offer filters are now available for kidneys and lungs and are expected for livers and hearts later this year.
That's fantastic. Well, another issue that we've faced in delivering organs to hospitals or getting them from the donor to the recipient is the actual physical transplantation or transportation of that organ. And AAKP's collaborated with UNOS and other transplant allies to address the transport of organs by commercial airlines. And in 2023, we joined many other stakeholders in calling upon the Secretary of Transportation to show greater leadership on rules related to this issue. Can you tell us a little bit about what UNOS is doing to address that issue?
Yes, definitely. So just for a little bit of background on this issue, following 9/11, there were updates to security protocols which made it so organs ready for transplant must fly in the cargo of a plane rather than the main cabin, which results in very timely process for time-sensitive organs. So, for example, organs being transported by cargo often must be at the airport 60 to 120 minutes before departure. And if an organ arrives after this cutoff, the organ cannot be transported on that flight. Additionally, if an organ arrives after a cargo office has closed, they have their own hours, then it cannot be collected by a courier. So this is risking the viability of life-saving organs making their way to transplant patients. And we've been working with AAKP, as Mr. Hickey mentioned, and the surgeons and other stakeholders in the community to support Congress to include a provision in the FAA reauthorization legislation to address this important issue. FAA reauthorization is due March 8th, and we were able to secure a provision, so we're very excited about that. Now we just have to see if Congress actually passes the whole reauthorization on March 8th.
Exactly. Fingers crossed there. Right, exactly. And can you tell us how UNOS has responded to the issue of CMS restrictions on patient access to molecular blood tests for organ transplant surveillance? We'll be discussing that issue later this morning,
Yes.
but we'd like to hear from you
Yes.
and your perspective.
Thank you. So from the UNOS perspective, this is a very important issue that AAKP has really been leading so well. It's impacting transplant patients, kidney transplant patients. It's an ambiguous billing guidance on molecular testing for solid organ allograft rejection. So UNOS actually has a statement in response I would like to share with you all. Transplant patients should have complete access to the best innovations available for maintaining transplant health and assessing transplant rejection or injury. Furthermore, transplant care teams should be the decision makers when it comes to patient care and must have clear guidance regarding payer requirements. It is widely understood that one of the benefits of transplant is that it minimizes the cost of care that would otherwise have been required. UNOS urges CMS to ensure transparency in the development of Medicare coverage policies and guidance and alignment with the goals of providing patient-centered, high-quality, life-saving, and life-enhancing care to all Americans, including those who have received an organ transplant.
Wow, thank you.
Thank you.
And then there's another issue up on the Hill that has been kicking around for longer than I care to think about, but it's the Living Donor Protection Act. And we saw tremendous UNOS involvement in 2023. And can you tell us about what you're doing to aid the passage of that legislation?
Oh, yes, definitely. So we are so happy to be locking arms with our stakeholder friends like AAKP on supporting the Living Donor Protection Act. This bipartisan bill has like 135 co-sponsors. So it has a lot of support in the House and in the Senate. And the selfless individuals who choose to donate an organ, they should not face any discriminatory barriers. So we have worked to be on the Hill, actively engaging with members of Congress to support the bill, and we also do have a statement on our issues and advocacy page on our website as well to support the effort. And we look forward to continuing to work with you all on this important bill.
That's wonderful. And they can access that through your website?
Yes.
Oh, great.
Yes.
Thank you.
Thank you.
Well, thank you, Alicia, for participating in today's event. And we look forward to greater collaboration in 2024.
Thank you.
And one of our other great collaborators is Ms. Peggy Tighe. And Can you give our audience a landscape overview of the issues that AAKP patient advocates should keep an eye on in 2024?
Absolutely.
Based on our shared principles.
Yeah, happy to. Thank you. There's an old adage in Washington politics, which is if you need a friend in Washington, get a dog. So I got 2 dogs. And then, I don't know, more than a decade ago, I was lucky enough to find Ed Hickey, Paul Conway, and Richard Knight. Not that they're dogs, but they're more loyal. They're more loyal than my dogs. They actually come when they're called, unlike my dogs. Anyway, just to say that having a relationship between the transplant surgeons and AAKP, the largest independent patient group, is incredibly important for transplant surgeons. So we cherish and really respect the relationship we have with you, and not only that, we do some really cool things together. So especially on Capitol Hill. So I'm going to highlight some of those things, and I made slides because, you know, in Washington you make slides. So you should see me at a party. I bring slides. I'm kidding. All right. So just getting in here, I'm again Peggy Tighe. I'm a principal at Powers Law and work with the transplant surgeons. You know about Congress. Congress is in a tough place, right? The political landscape is just brutal. I've been doing this for longer than I want to admit, and I've really never seen it this bad. The bipartisanship is almost nil. It's very frustrating to try to get anything in a bipartisan way moved in Congress. Republicans and Democrats between the House and the Senate, it's tough. But I'll tell you this, I have never seen a Democrat or Republican kidney, right? This issue is really important here. Politics should have absolutely nothing to do with kidneys and kidney health and patients' health. So that's the approach we take as transplant surgeons, working with our friends at AAKP about throw aside the politics, we can get down to brass tacks and do the right thing for kidney patients. So I strongly urge your many, many advocates of AAKP to take the approach, don't worry about the politics, let's talk about the need and how Congress can actually help you. So moving through really quickly, I just want to highlight 3 incredibly important things, one of which we talked a little bit about already, the Living Donor Protection Act. Then we're going to go into OPTN modernization, which Alicia touched on, and then talk about bills to reduce financial disincentives. So these are 3 places, again, AAKP advocates can get involved quickly. It's not that hard to catch up and understand what's happening in each, and I'm going to try my best to give you a quick overview of each. So Living Donor Protection Act. What did we do as friends together is there was a lot of confusion on Capitol Hill. What should we do? Should we give people money for kidneys? Oh, no, that would be a very, very bad idea. We reduce financial incentives, right? How do you reduce financial incentives for kidney to have somebody be a living donor, right? So it's really important that we oppose coercive financial incentives. That sounds like gobbledygook, right? Think about it. I'm going to give you, poor person, money for your kidney. Anybody can figure out that's a really bad public policy idea, right? Because who's going to end up giving all the kidneys out? The marginalized populations, the poor folk. It is not okay. So the law established many, many years ago said, we're not going to do that as a nation. It's immoral, it's wrong. Do we want to put a kidney in everybody who needs a kidney? Of course we do. But we shouldn't do that by undermining people. And the people who would be undermined the most would, again, be those poor or more marginalized communities. Believe it or not, we have to, on a regular basis, educate Capitol Hill, other policymakers, other stakeholders about this is an immutable principle that we believe so strongly in, that AAKP, ASTS, and AST, our other very strong, loyal, trusted ally, American Society of Transplantation, got together and wrote a statement. And that statement you can find on all of our websites, talking about how you should look at living donor protection and the best way to handle it. And one of the best ways to handle it is removing those financial disincentives to transplant that I just talked about. That's what this bill does. 2 major ones, employment and insurance. What matters to you? If you're going to give away a kidney to somebody else, probably are you going to keep your job? Probably are you going to be able to keep insurance that you need, right? So the LDPA tackles those two incredibly important issues. And the third thing it does is it says, hey, agency, go tell the world that those two barriers have been removed. The public education component of this bill is incredibly important. You have to have those three things so that people know those financial disincentives have been removed and those financial disincentives are actually removed. So we are also big champions, have been fighting this for a long time, and really hope we can get past the politics with your help, AAKP advocates, to move the Living Donor Protection Act for the first time and make it reality.
Yep. We have industry on our side as well. I mean, the life insurers are with us. Everyone is with us.
This is the coolest new news, is in the last 2 years, we worked closely with the American Council of Life Insurers. Life insurers jumped into this fray and said, hey, we don't think we're discriminating at all against people. We're like, yeah, but you are. It actually is happening because you have things on your forms that say, have you had a surgery in the last year? Oh, if you've had a surgery in the last year, that might indicate, oh, okay, you gave away your kidney to somebody and then your rates went up. What about, I gave my kidney away for somebody for a really good reason. I'm super healthy. The only reason you can give away your kidney is you got to be super healthy first, right? So if I'm a life insurer, I want to give you insurance. You're my cherry-picked, beautiful person because you're so healthy you were able to give up one of your kidneys, right? So we, our stakeholder groups, NKF and other groups, were able to pull in the life insurers and other insurance companies to say, hey, this won't hurt you. This won't hurt you because you say you're not doing it, and you're going to get really healthy people. So we now have a coalition of everyone. Nobody's against this bill. That's a good place to start, and that's an important effort that we moved forward in the last couple of years. So here are some specifics about the bill. The bill for the first time was introduced with, look at how many, 1, 2, 3, 4, 5, 6, 7, 8, 9 original sponsors. That's a lot. Why did we do that? We did that so that we could make sure we can move the bill. That bill had been introduced for, 15 years with 2 leads, a Democrat and a Republican. That's lovely. We added a whole bunch more because we wanted more people to help us move this bill. That's why we have so many on the House side, because there's a lot of committees we have to run through on this. So moving forward on a Living Donor Protection Act, please keep fighting for it. I really believe this year, I hope we can pull it off. If not, next year's got to be our year, because it's been way too long fighting on this one. Huge news in Congress for transplantation is OPTN modernization. So modernization of the transplant system is a better way to think about it. So last March, I believe it was, Congress wrote a tiny little bill with a handful of words that says, go change things. And the agency said, okay, we want to change things. So what are we going to do to change the transplantation system to make it work better? And they came out with things I cannot read on that screen, but hopefully I've memorized them. Basically, better communication, better data interchange, how the contractors are working well with one another, those types of ways to make more transplant happen is really what the agencies are working on right now. So a lot of stakeholders like me and UNOS and others who work in this space are trying to guide the Health Resources and Services Administration, which is under HHS, a lot of acronyms, a lot of letters, I'm sorry, but the agencies, to tell the agencies this is the right way to do it. So once again, you shouldn't be surprised. Our friends, AAKP and ASTS, got together and said, here's how you should do it. We wrote an exhaustive paper, not exhausting, but exhaustive, we think, paper saying, don't mess this up. It's all about the patients. It should be all about the patients. You need to do this right. There shouldn't be unintended consequences. Take your time, do it very carefully, and make sure you're not upending a system and potentially harming patients. So that paper is also available on both of our websites if you want to take a deeper dive into what it is we're asking them to do, and also importantly, what not to do in this new modernization effort. So that one is hot, that one is happening. Something happens, it seems like, every day on this, so please get energized and excited about informing the federal government how to protect patients through OPTN modernization. There are other bills that have come out recently because a lot of people are jazzed. probably about transplantation and kidney health because of you, because you keep talking about it. Yes, thank you for doing that. Congress is listening to you. They're hearing you, and they're doing things to remove those financial disincentives. They kind of listen to us, too, and realize that it's important that we're not handing people money, because that's a dumb idea, right? We all learned that today. Removing financial disincentives is how to do this, and there's a couple bills out there that do this pretty darn well. One is a tax credit. There is also a system some of you might not know exists, which is called the NILDAC, the Living Donor Assistance, National Living Donor Assistance Center. NILDAC, you can look it up, Google it, NLDAC, provides help for people who are trying to give an organ, a kidney usually, where you can't, because you can't give a heart as a living donation, but anyway, to give a kidney, your medical expenses, your travel, your food, all that stuff. Remember financial incentives we talked about, financial disincentives? If you have to pay for something out of pocket, you might be less likely to give that gift of life. So NILDAC takes care of that. In comes members of Congress who are saying, why don't we give them a tax credit too? Wouldn't that be a cool idea? So they, the Hill sponsors, checked with NILDAC and made sure that wasn't going to interfere at all with what NILDAC is already doing. So now there's another way, a tax credit, where folks who are trying to give that gift of life can be protected, and that bill, I hope, will move through Congress. Further, there is a new bill in the last, why did I choose green? Anyway, the last bullet on the screen, I think, says that Representatives Del Bene and Bouchon are going to introduce a bill that also removes some other barriers that exist for NILDAC. So there are barriers to limitations and caps on how they can give out assistance that will be removed by passage of their yet-to-be-introduced legislation. And AAKP, I promise you, you'll be the first to know when I know when that bill drops, because I think we should all go fight for it. What it looks like right now is it's going to be really helpful in this space of removing financial disincentives. And with that, I'll stop talking.
Thank you. And just the two co-sponsors of that bill are the chairs of the Kidney Caucus and our good friends up on the Hill.
Shockingly so, yes.
Thanks, Peggy. I appreciate that very much. And I'll turn next to my good friend and colleague in crime, Paul Conway. And Paul, can you tell us some of the types of the campaigns that AAKP will be deploying in 2024 so advocates can prepare to take action?
Sure, Ed. And I tell you what, it's always fantastic to hear from our good allies at UNOS and the American Society of Transplant Surgeons and AST. What the terms are that people have heard here are friends and allies and coalitions and collaboration. And so in 2024, you're going to see a much more aggressive stance by AAKP on bills that matter and legislation that matters, and executive branch actions in policy implementation. One of the fastest ways to get involved with AAKP is to become a member. There's no cost, no barrier to entry to be a member of AAKP. And what that will do is put you in the stream of information on many of these issues that Alicia and Peggy have talked about and that you've raised, Ed. And so for 2024, we're going to have very proactive social media campaigns to raise awareness. We have Capitol Hill Days that we do in alliance with ASTS, National Kidney Foundation, American Society of Nephrology, and others. And people will have an opportunity to participate in those virtually and in person. We're also going to be focused on state days. So if there are particular elected leaders from certain states in Congress that need to hear a voice that haven't really heard the full voice of kidney patients, we have the capacities now to light up certain states and let their delegations know quite clearly that their vote really matters in committees to get things out on the floor and to get bills passed. The other thing that we'll be doing is sharing much more of our press activity with patients and asking them to share articles across their social media platforms. And coming up here in March and April, March is Kidney Month and April is Organ Donation Month. And you will see us working in close collaboration with our allies here. But the most important thing people need to understand is this: your voice matters and it's easy to get involved. But the other thing is register to vote and be a kidney voter, because that is really what is listened to up on the Hill. There's a good inclination to listen to patients and the impact of disease on people's families and people. But the other thing that elected leaders like to know, and Peggy and Alicia know this quite well, is this: that people are organized, they have a concern, and they do vote. So back over to you, Ed. Thank you.
Thanks, Paul. And that's just such a key point. And congressional offices love to hear from their constituents and really do want to know what they're thinking about particular issues, because they deal with so many issues on a daily basis that to have people who are concerned that they can help, that's why they're there, and they really do want to help. So thank you very much for that. And Alicia and Peggy, thank you for your remarks. I appreciate it.